Hello everyone and welcome to a new segment of Is Our Voices. In this segment, we will be discussing mental health and the stigma around the subject in Lebanon. If you haven't watched our first video, it is linked in the bio, check it out. So after the discussion we had with Yasmina and Rawad, we have now faced to us the head of the National Mental Health Program, Dr. Chammay. Thank you so much for being here, Doctor.
Thank you, Nour, for this opportunity to talk to you about mental health.
So we're going to start with a couple of questions. Could you please define to us what is mental health in general before we get into more detailed questions?
Yeah, before giving maybe a technical definition of mental health, let's just ask ourselves the question, what does it take for me to be in a good health, to feel I'm in a good mental health and psychosocial well-being? I guess we all know deep down what we need, right? We need to feel safe, to feel loved. We need our basic needs to be met. We need to feel that we're in good term with our close relationships. We need to feel like we can provide for people we love, we can contribute to our community, and that we have a positive outlook on our future. So when we talk about mental health, we're talking about a overall state of well-being, biologically, physiologically, psychologically, and socially, where the person has a sense of purpose and meaning and is able to contribute to his fullest potential to his community.
Okay, so regarding these questions, I think we are all aware that there are mental health disorders or mental health issues in general. Do you think there is a cure to them?
Well, maybe before going to treatment, it would be important just to remind us all that mental health conditions or mental disorders are very prevalent. What does that mean? It means that 1 person in 4 will develop a mental disorder in their life. Okay? So if it's not us, it's someone very close to us. There are different types of mental disorders. Like when we speak about physical health, do we say like, are all physical illness curable or not? I don't think we would ask that question, right? Because there are different types of illnesses. When it comes to mental health, the same holds true. Most mental health disorders are curable in the sense that a person would go through them and go back to their life usually. The rest of that, which is around like maybe 10 to 20% of the mental disorders that are more of a chronic state, if the person has access to the proper care, which means medication, social support, psychotherapy, they can live their life normally even while having the disorder. The example that I give is if someone has diabetes, can they lead a normal life? Yes, of course they can lead a normal life. If they have a good diet hygiene, if they see their doctors regularly, if they take their medication, they exercise, and they take care of themselves. So the same is true even for the most chronic and the most severe mental disorders. So if we have 10 persons who are experiencing right now a mental disorder, 8 of them will be experiencing transient mental disorder, which means either anxiety or depression, with the episode that would last, if treated, between a few months to a year and a half or something like this, okay? So those 8 persons, if they have access to the proper treatment, they will take the treatment, they will recover and go back to their normal life without medication. They go back to how they were before. Like someone who have broken their leg, they need time to recover, but once they go back to their lives again. The 2 other people who will have more of a chronic mental health condition like schizophrenia or bipolar disorder, if they have access to proper care, I think we can think of it as someone who has diabetes, in the sense that they do need to take medication for very long periods and sometimes for all their lives, but they can live normally, get married, go to the work, have children, and enjoy life as we all do.
100%. So also in the last discussion we had with the students, we kind of asked them a question, which was, what advice would you give for people who are going through these through depression or through anxiety? And most of them said, seek help. So I have a question to ask you regarding this. When do we know that we need to talk to someone?
I think the default setting should be always talk to someone you have trust and you have a good relationship with about your struggles. You don't need to wait till things gets complex, complicated, or very painful. So always rely on your network, and let's not underestimate the importance of family and close circle of friends. So if we're going through a hard time, what do we do usually? The first thing we do, we try to resolve it ourselves, right? We try to exercise, to sleep, maybe to meditate, maybe to pray, maybe to do yoga. I mean, every person deals with it differently. Some people, unfortunately, would resort to harmful coping mechanisms like alcohol or drugs, but the aim is to lessen the pain initially. So we try to deal with the situation on our own. And when we find that we're struggling with that, the next step that we go to usually and spontaneously is either family or friends. And we talk to them. And because mental health is getting more mainstream in Lebanon and people are more aware of it, most of the time we can find people who are welcoming, who are not stigmatizing, who don't have all those wrong idea about mental health, and who can listen to us and guide us towards support. The level after that is really seeking support from people, from professionals, whether the family doctors or the general practitioner, who can also to a certain extent talk and assess if there's a need for intervention. And at the higher level also we can have a psychiatrist or a psychologist. And now in Lebanon, actually, because you might tell me, Nour, that okay, some people want to talk but they don't have anyone to talk to, so where do they go? So in Lebanon we have the National Hotline for Emotional Support and Suicide Prevention, the Lifeline, that is co-managed by Embrace NGO and the National Mental Health Program, 1564. Now it's operating from noon till 8 in the morning, if I'm not mistaken, and soon it will be 24/7. And there you have operators you can call. If you don't have credits, you can do a missed call and they will call you back, and you will have someone listening to you, trying to help you calm yourself down and help you get access to the services that you need, and in a very confidential and private manner. So do not hesitate. There's a lot of listening and welcoming ears for you.
100%. Thank you so much for bringing up Embrace, by the way. We also discussed it with the two participants that were in our discussion, and we will be linking down below more information regarding Embrace and obviously the hotline that they hold. I also have a question that is more centered around the topic of men and mental health. We discussed this with a lot of people, and we found that men mostly find it really hard to seek help and to talk about their problems, mostly verbally, to talk to anyone. Actually, they don't like to bring these things up. What do you have to say to these men, whether it's teenagers, whether it's adults, who find it really hard and don't want to open up regarding their problems?
I think gender in general has a big impact on health. So whether you identify as a woman or as a man or from a sexual minority, this will impact your help-seeking behavior. So this will impact what do you think is allowed or not. So to a certain extent, we still have in Lebanon very traditional communities and culture, in a sense where it's okay for a woman to express her sadness. It's okay for a woman to cry. It's not okay for a man to say that they're sad. It's not okay for them to cry, but it's okay for them to express their anger. It's okay for them to smoke a lot, to drink maybe. And all of that is what by the traditional culture was allowed for the woman and for the men. So we would find it very weird if a woman expresses her emotion by being extremely angry and violent, or if she smokes a lot, and very weird if a man cries and say that they are sad. So in our mind, we have kind of small boxes of how should a woman, how should a man express themselves. I think it's really important, especially for the younger generation, and I'm extremely, extremely pleased to see the younger generation so brave and courageous and talking openly about their mental health needs and their mental health uh, struggles, and also wanting things to change. I think it takes huge, huge amounts of courage to speak out, to seek help. Part of the process of getting better is getting over the fear of asking for help and saying like, I'm not okay. So for the men who think that it's a sign of weakness, I would tell them, if you have broken your leg, would you hesitate for a second to go see someone for that? It's the same thing with mental health. If you're suffering from a depression, from an anxiety, or from a bipolar disorder, or any other type of mental disorders, it's the same. The only difference is that you don't see it. You can't see it with your eyes, but it doesn't mean it's not there. It's not real. It's real. It's health related. There are solutions. You can get over it and go back to your life and enjoy it. The first step is really to conquer that fear and to ask for help. And if your surrounding does not allow for that, call again the National Hotline for Emotional Support and Suicide Prevention. They will refer you to services available around you that are either for free or with very nominal symbolic fees.
100%. So what you said was actually very helpful, and I believe that what you mean mostly is that seeking help is not a sign of weakness. Just like you said, doctor, it is a sign of strength. It is being brave. It is conquering our fears. So it is exactly the opposite of what society portrays it to be. What do you think might be the earliest signs to look out for?
I think it's really important to stay in touch and to do kind of regular checks with saying, okay, so how am I doing? How am I feeling? How am I going about my life? How am I going about my tasks, about things that I said to myself on doing, about my studies, my work? And if we find ourselves in a place where we're always sad or we're always very anxious, we're having really difficulties for sleeping, our appetite is not the same, we're not enjoying things that we usually enjoy, we're not feeling motivated to go see people whose company usually is a nice one for us. We might have difficulties in the way we process things. So what we used to study in 1 hour, now we need like about 5 hours just to try and understand what's written. We have memory problems, and in some severe cases, even we might have dark thoughts, ideas of harming ourselves, of ending our lives, of wishing that it might be better if we sleep and we don't wake up. So if we're experiencing any of this and it is lasting for, you know, the low mood, the anxiety for more than a few days, and there's no event, if I'm preparing for my exam, of course I'm going to be a bit anxious. But if these symptoms are there to stay and they are really impeding me in my day-to-day life and they're changing my quality of life, it means like it's about time I get an opinion, because I might be actually struggling not only with high levels of stress, but maybe this high levels of stress have already put me in a more difficult situation where I need someone else, a professional, to support me.
And I think a lot of people are going to come to a realization that seeking help and talking to someone is actually a very clear solution. So thank you so much. So do you think that these hotlines, that these organizations would be a solution to people who don't have this clear access to mental therapists or to psychologists?
I think that's a very important question, the question of access to services. And we at the National Mental Health Program have been working with all our partners to increase access in Lebanon. So in terms of hotlines, there's one hotline for emotional support and suicide prevention, the National Lifeline, that Embrace runs with the program. So that's the only number, 1564, okay? There are other hotlines for other maybe matters related to violence or child protection, but for mental health, this is the only hotline. In addition to this, in the last 7 years, we've been working really on widening the mental health services. And what we've been able to do, we've studied an application. It's called Step by Step. We did a big study on it, international study with the WHO, the World Health Organization, and other partners. And it proved to be very effective. And now in 2 weeks, we're gonna launch it, and it's free. So it's an application with 5 sessions. The person, they can go with each session, and they also have support from an e-helper who's been trained to support them navigate the application. And they can create an email. They don't even need to identify themselves. So they create the email they want to create an account. And then they start on the intervention has proven to be very effective for depression, and it's free of charge. Second, we're working on integrating mental health in the primary care centers network of the Ministry of Public Health, also with partners. And we have a number of what we call community mental health centers, which are centers where you have a psychiatrist, a psychologist, a social worker, and outreach workers. Those are run with NGO partners for the program. And we have a map of all those services available also for the operators on the 1564. I want to know what are the services close to me available if I live in or if I live in the Bekaa or in the south. I can call 156 and ask them, what are the services for mental health available close to me? I live in, let's say, Sur, and they will tell them where are those services, and they will give them the contacts. So services are available. People maybe don't know about them yet, and still we are working on increasing them more. So don't be afraid of not asking for help because it's going to cost you money. There's a range of services that is available for free.
So I think that what you're doing is excellent. Thank you so much for your work. So now you know that we're in the situation where because of COVID-19, and because of the situation in our country, in Lebanon, we are getting very affected. Our mental health is getting very affected. I would like to ask you, would there be a way to recover permanently from the situation that we've been in Lebanon? How to deal with it? Or do you think that after it's all done, we're going to be fine, we're going to go back to our daily lives? What do you think about this matter?
I think this is a very timely question. I think what COVID has shown us, it has shown us that our economies, the systems that we've built, our priorities were not in the right place. It has dismantled all the support network that we usually use as people, you know, the family, the friends, especially the youth and the students and the schools and the university, you know, campus life. This is the bonds you create in university that would last for a lifetime afterwards. All of that was disrupted. Add to it, if someone has COVID, usually if someone goes to the hospital for an operation, and that's pre-COVID, you would find all the family, friends, and sometimes all the village, right? Coming to support them and to bring them food and flour and all of that. And what COVID did is that it put people in a very isolated situation, struggling with their own physical and mental health challenges. And now we know that worldwide, COVID will have huge impacts on mental health. And the second pandemic, if we don't actually act now, is going to be a pandemic of ill mental health. So mental health is severely affected. And add to it in Lebanon, in addition to the COVID, we have a political crisis, we have an economic crisis, we have the Beirut blast that also decimated half of the city and killed about more than 300 people, injured around 6,000, and displaced around 300,000 persons. So in addition to COVID, we have those. And the question becomes here, okay, so what do we do about mental health? Should we, isn't it normal for people to be depressed in this situation? I mean, isn't that a normal reaction? Shouldn't we only be working on addressing those big elements like the politics, the economy, and things will be fine? And my take on it is a bit different. And I'm going to ask you a question, Yasmin. If you know that you have a sidewalk in front of Eza that's slippery, right? And people tend to fall and break their legs. What's the obvious solution to this? What would you do?
Fix the sidewalk.
And
warn the people about it. Make sure they look.
And for those who broke their legs?
Treat them.
Treat them. So you wouldn't just treat people, right? And you wouldn't just fix the sidewalk. You would work on both. And the same holds true for mental health. Of course, mental health is affected by all what's happening in Lebanon. And of course, the stressors are higher. And of course, we need to find political solutions. We need to find economic solutions. But for people who are right now suffering from a depression, anxiety, a relapse of their bipolar disorder or their schizophrenia, they need also appropriate care, and they need to have access to care. So the response to that is to work on both. And if we do work on both, and if we learn from what COVID has taught us in terms of really prioritizing health systems and investing in the health system in a way to be able to respond to pandemics, but at the same time, be humble as humanity and start really to act in terms of the agenda of the climate change agenda, and be humble about our impact on the environment, I think things will be better on the long term. But for now, we do need to take care of mental health. Actually, yesterday, not today, because COVID has deeply shaken all the bonds and all the foundations on which good mental health usually relies in societies.
100%. And right now, on an individual scale, what do you think we can do to maintain our mental health within the situation?
I think when we speak about what we can do, what I would like to say that there's a lot we can do as individuals. It doesn't mean that the responsibility is ours to fix everything around us. What we can do, it starts with us having a healthy lifestyle. That means eating healthy, sleeping enough, not smoking, not drinking, not smoking up, not using substances and alcohol. I mean, of course, some people would drink alcohol from time to time on weekends, 1 or 2 drinks. But what I mean is that resort to it as a solution is really harmful. A lot of studies have found that. So we really have a healthy lifestyle. Add to it exercising regularly. Even if we walk 45 minutes 3 times a week, studies have shown that that is very good to the mental health. And in some cases, for people who have depression, it can be as good as medication. So physical activity is really, really important. Second, keep engaging in our social connections and our leisure activities. Try to find something meaningful for us to invest our time and energy and to support people around us. That's also very helpful. Be there for each other. So if we're not feeling well, talk to people we trust. And if we notice people around us not feeling well, like they're becoming more isolated, they look sad, they don't engage as before, just ask them, how are you? How are you feeling? Kifak, kifik. And encourage them and ourselves to seek help when we need it. Let's not hesitate in that. I think if we do all of this, we would have done about 80% of what we can do for our mental health.
If we see that something is wrong, if we see that our emotions are being affected, there is a root to it, there is a reason to it, and we must take action and follow the steps that you just mentioned, Doctor. So thank you so much for all of your answers. Thank you for everything you are doing to our country and to each individual struggling. This was really great. Thank you so much for coming, Doctor.
Thank you, Nour, and thank you for, again, your interest in mental health, for the very pertinent questions.
Thank you so much. Thank you everyone for watching. We hope you enjoyed it. Let us know what you think in the comments below, and don't forget to like, subscribe, and turn our post notifications on to stay updated with Isa Voices' videos.